All right, so I'm gonna wash my hands, check the patient's chart here, and I've gathered all my supplies for the skill, and I'm gonna enter the patient's room.
Come in.
Hello, I'm Travis, and I'm gonna be your nurse this evening. Could I get your name and date of birth?
212XX.
All right, could I get your name?
COPD.
All right, awesome. So I'm just gonna first raise your. Oh, I'm gonna give you some privacy. All right. Do you have any allergies, COPD?
Not that I know of.
All right. Nothing to tape or antiseptics.
No.
All right. Awesome. So we'll be using those this evening for the procedure. I'm gonna be changing your central line dressing. It's due for a change. It's its third day. So I'll be removing the old one and putting on a new one, and then I'll be changing one of the caps on your lumen and heparin locking it. Does that sound good?
Okay.
All right, awesome. So for this procedure, I'll just have you turn your head away from the central line, because when I remove the old dressing, we just don't want it to get contaminated. All right?
All right.
All right, awesome. So first thing I'm gonna do, set up my triangle. Rewash my hands, touch the garbage, and then set up my sterile field. All right, set this to the side, and then I'm gonna put all the pieces here. Awesome. All right, and then for video purposes, I'm not going to wear the mask, but I would be wearing it for this procedure. All right, so I'm going to put on the gloves here. All right, now I'm going to be removing your old dressing here. I'm going to remove the old, first I'm just going to remove the old anchors to the lumen. Which are on really, really good. There. All right, so now I'm going to start removing this. There we go. This might come off like a band-aid, but I'll try to do my best. Alright, there we go. Alright, so I'm just gonna assess the site here. Do you have any pain at all?
No.
Alright, awesome. So I'm just looking for any inflammation, feeling for temperature. It's all looking good. Any signs of infection? None. I'm just gonna make sure these caps are closed. Here. They all look closed. Perfect. Alright, so now I'm gonna clean. Oh. First remove my gloves. Alright, rewash my hands. Alright, and then I'll put on my sterile gloves here. now that I have my clear gloves on, I'm gonna go ahead and I will clean around the site here. I would break this, the chlorhexidine capsule in there, and I would clean it in different directions here, all around, while anchoring it, making sure not to move it or pull it out of place here. Alright, and I'll be cleaning it for 30 seconds. Different directions. Alright. Alright, then I will let that dry. Let that dry, and I'll throw that in the garbage. Alright, and then now I'm going to reapply with my sterile hand the new dressing here. Making sure that it is in the center. I'll push it down. There we go. Alright, awesome. Making sure that's all down good. Look at that. Alright, now I'm going to measure the site here. Alright, I have from the opening, I got 3 centimeters, and then I will double check that with the MAR once I'm all done. Alright, and so now I'll be changing the cap and flushing it. So I've done my 3 checks on the MAR with my normal saline. Yep, good to go. Keeping try not to contaminate. There we go. Alright, and I'll grab women needing to change the cap. Oh, before I do that, actually, I'm going to prime the cap here. Drop once it comes out. There we go. Alright. So I'll grab the cap here. There we go. Perfect. Alright. And now I can unclamp it. Alright, and then I'm going to aspirate for blood here and see if there's any blood. And if there's no blood, I would reclamp it and not flush, and I would document and then contact the appropriate provider for it. Alright, but since there is blood, I will push this over a minute. Get my time here. I'll slowly push this over a minute. Alright, it's been a minute. So now I'll reclamp this. This can be tossed in the garbage. And now, no, that is wrong. I would keep that on, I would keep the normal saline on and get my heparin ready, and then remove the normal saline and push this on, so I don't break sterility. I'll unclamp this, and then I will also be pushing the heparin for over a minute. Anytime. Alright, I push that for over a minute. And now I will clamp this shut. And the heparin is good to go. And I would actually put this away in the sharps container. Alright, and so now I still need to anchor the lumen down and label my dressing. So I will do that. Alright. Perfect, I got those anchored down, and then I will label this here with a piece of tape. I have a marker. I'll put a piece of tape on here, and I will put my name, date, and time, which is 5:07. So that the next nurse that comes checks it, knows it. And then I would put my sterile gloves, wash my hands, clean up my field. I will lower the patient down. And do you need anything else?
No, it's good.
Alright, awesome. How does that feel?
Good.
Alright, awesome.
Great.
And then I would go document the change, and I'm done with the skill.